We continue our crime focus right here on the program. For this discussion now, we focus on the impact and trauma of substance abuse. The South African Depression and Anxiety Group's Substance Use Coordinator is Tebogo Ramadiro and joins us now via Teams. Mr. Ramadiro, thank you for your time this hour. I want us to, first of all, perhaps start unpacking this multi-layered, multi-dynamic conversation. We just heard their colleague Ayanda Nyati out in Everton engaging with some of the communities hardest hit by the scourge of drug abuse, the impact of drugs on society. I mean, for me, I'm still reeling from just having to hear a parent there, just saying that they just never know when their child might not come back home at night, and having to have their child, be at the wrath or the mercy of community members who are always upset or angry with them because they had allegedly stolen something to feed their habit. Clearly something needs to be done, but let's start with potential root causes and what we're looking at here. Are we still having that conversation about potential peer pressure or other societal issues that we sometimes might not even paying mind to?
Thank you so much, Kolisi, and thank you for having us. So it's quite an important conversation that we're having today, this discussion. And what we picked up is that we first need to understand what addiction is, So addiction is not a moral failing or a lack of willpower, but it's quite a complex condition which involves environmental, biological, and psychological factors. So when we hear communities, parents crying, the users struggling with this addiction, is for us to understand that it's not just only peer pressure, but peer pressure is one element, but there's other factors which could be biological or psychological.
And clearly there must also be some sort of trauma that can be associated with all of this. I mean, listening to some of those parents there in conversations, going at length to talk about what usually happens in their households. I mean, first of all, these are human beings, Tebogo, just moving in terms of trying to find how they get assisted. And it's not like some of them don't even want that assistance. It's because it's just simply not available to them.
So true, there's the trauma element of it that we need to consider, because some of the cases reel from us understanding what trauma is, and in some cases the families or the users, one would highlight to say, look, I've lost my father or my mother. I don't know how to deal with grief, and this could lead to depression or to anxiety. So we cannot necessarily say that help is not available. I think it's about the community knowing where to reach out for help, because we've got various stakeholders. We've got the police, but we also got the substance abuse helpline at SADC, where we can connect and educate our family members to say, look, this is what you are dealing with. This is what your child or your brother or your sister, is experiencing when we're talking about substance use or substance abuse. So I would like to say that help is available. It's about how do we plug in that help? How do we understand where to go or search for the help?
And Tebogo, you're talking about trauma now and how it also needs to be addressed, and as well as finding ways to dealing with whatever that it is that we are going through. I want us to put a focus specifically on communities such as the one in Everton where Ayanda Nyati, for instance, is right now. These are young men mostly, who are playing straight into some of the stigmas that we'd hear in our communities, that indoda ikhali, a man doesn't cry. How do we perhaps deal or, maybe turn the tide against such conversations to say that it's okay when you are way in under, when you are way over your depth, and how do you go about getting help? It's okay to seek help.
Thank you so much, Kolisi, for raising that point. A lot of our young men are really isolated. So these are not, we cannot say, I think we should stop saying men don't cry. So you see these cases of overcrowding in our prisons, GBV cases, these are silent cries, These are silent cries that men are saying, look, we are struggling with our mental health, but we don't know how to deal with it. So it's about us fostering these conversations and having open dialogues, like the ones that we're having now, to say, look, let's encourage our men to say, find healthier ways of talking out, not being silenced by the fact that we only resolve it via violence. So these gender-based violence cases, these overcrowded prisons. These are silent cries for men. So men do talk, but they're not talking in a way society expects them to.
And even more devastating for me is to watch the ripple effects of substance abuse, as we've seen throughout the course of this morning, that ripple effect, and it takes me back to the saying where you'd have someone say, hurt people, hurt other people. Just how do we address all of that in terms of bringing it back to the communities, in terms of the conversations that we should be having at community level to address all of these issues, to say that, listen, we need to be moving together as a unit, the stigmas aside, the judgments aside, but to have community members, as that, there's this sense of ubuntu in most communities, but sometimes we have community members that get fed up with what they see happening because of these drug-related crimes.
So that's an important question that you're asking. So conversations need to move away from blame and shift to more understanding and support. And people do get tired. Do understand that element, But okay, what is critical is that for family members to also notice that the person who's struggling with addiction they're not themselves. As I went into the community at Everton. If I can make an example, somebody who smokes crystal meth, they need to smoke 5 times a day. That's why you see that they have to feed on that habit, at which the bed will go around 50 rand, the street value. So if they have to smoke 5 times a day, that's 250 in a day, 1.7 in a week. That's like 7,000 in a month, if my mathematics is correct. So it's us having open, non-judgmental conversations as society. So we need to address the stigma around addiction, and not just treat it as a health condition, not just a criminal, issue. So it's these deep conversations that we need to have.
Okay, I must thank you so much for your time. That is the SADC's Tebogo Ramadiro speaking on trauma due to substance abuse. Thanks very much indeed for taking the time to break this conversation with us right here on the agenda. And of course, you can get in touch with SADC on 0800 12 13 14. We did make those numbers available to you there on your screen. You can also send them an SMS to 32312.